Something very, very physical. Now, there are other technologies as well, and um, many of them are perhaps a little harder to understand. But one that is very interesting uh, comes from France, and by a gentleman named Antoine Priori, and he worked with the equivalent of the French National Academy of Sciences, and was able to cure and publish reports about curing uh, very nasty cancers in many, many laboratory animals um, in the 1960s. And it's still available at any medical library. You can go find the journal articles and see his experiments as published. And I was always interested in seeing whether or not this would work in human beings. And so about a year ago, I had my chance to work with a team. I was working with a doctor to apply this kind of technology to human beings. And most of these were terminal cases of end-stage cancer, liver cancer, adult leukemia, adult lymphoma, adult pancreatic carcinoma, which these are all the worst cancers. They're particularly pancreatic cancer is considered a death sentence. So some of these, the survival rate for pancreatic cancer is like 7% just for stage 1. And this team, from the experience that I saw, and this is anecdotal, but there were many patients that were able to come for 1 month of treatment, and in that month be returned to their doctor and let their oncologist, their cancer doctor, evaluate where they were at, and after running the tests and the imaging, just show or demonstrate that those doctors couldn't find any cancer, in the body. And so, very, very exciting stuff. It's a technology based on a so-called magnifying transmitter or oscillator shuttle circuit, in which there's some fairly advanced physics involved. You can look at the understanding of the device is actually depends on the complexity of the mathematics that you use. The more dimensions that you use, the more you rely, for example, on complex equations in which all electromagnetics are based on. All electromagnetics, people don't know, actually routinely use the imaginary number I, and I is the square root of -1, which is very difficult to actually think about what that is. But mathematicians think that it's an actual dimension in imaginary space or complex space, and they model it in different ways. But they think it has it changes the phase. So sometimes you'll hear a phase space. Well, what's interesting is that this device not only has in patients with these cancers somehow been associated with remissions of those cancers, but also stimulated liver regeneration. So there was one patient who had very little liver left from end-stage liver disease, and he had his entire liver grow back. And so this was an amazing experience for me, because you can almost see how the trajectory in my life was one of, as a young, teen, having all this hope and aspiration, and faith that electromagnetic medicine could have a profound effect on human beings, and working it in the lab, and then to one day actually seeing actual people have their lives saved, or turned around. At least you can say that. It's pretty amazing. And yet I think helping a few people here and there is really is not enough. It's only the tip of the iceberg. And I'm now perhaps embarking upon that one aspiration that I first had as I was a kid, was to see if this technology could help Parkinson's patients. And so we're starting to put together the infrastructure and the technology based upon some technology that's out there that I'm aware of, that can actually, that in a few patients there has been some indications that the Parkinsonian symptoms have gone away without any medication. Usually they take certain kinds of medications to control the shaking, and so we'd like to evaluate that, and we have a place to do so. I think the interest is there, and perhaps in the next segment, I can actually hopefully tell you the results. And so in 22 years, I've actually am now going to perhaps get a chance to make good on my promise to my father. So let's see what happens, and I hope you tune in, and at the next show I can give you good news. Thank you very much.